Hi, I'm Lisa Florian, and I recently received my Master in Public Health from the University of Arizona. And last year, when I was a student, I received funding from the Western Region Public Health Training Center to work with the City of Tucson on a project exploring health and chronic homelessness. Today, I'll give you a brief overview of chronic homelessness and how it looks in my community. I'll also review the activities I undertook for my project, share some findings, and provide a brief summary of key recommendations. So chronic homelessness, it's a definitional term used by the Department of Housing and Urban Development. And as you can see here, people who experience chronic homelessness are often the most vulnerable of an already vulnerable group. These are individuals who are living with a disability and also have very long or repeated experiences without housing. On top of that, they often face a number of co-occurring health issues. Here in Tucson, our rates of chronic homelessness have been increasing, and the health concerns among this population largely reflect those national trends. Cycles in and out of housing limit the ability of individuals to recover physically, mentally, and financially. And the repeated losses of housing also burden our social service systems. So for my project, I worked with Tucson City Council member Paul Durham's office to explore potential solutions. The city was interested in approaching chronic homelessness from a public health perspective in order to gain insight about policy ideas that could improve health and potentially help our housing systems operate more efficiently. So my guiding question was basically, how can a government office help reduce chronic homelessness? And to tackle it, I took on these three activities. So first, I spoke with leaders from the 4 communities in the US that have effectively eliminated chronic homelessness. And all 4 of them recommended regular conference calls between everyone involved in an unhoused person's case. They also all recommended focusing on housing first, which is an assistance approach that prioritizes giving individuals permanent housing as soon as possible and without requirements or demands. The other suggestions there that are in lighter blue, those also came up multiple times. Next, I participated in conversations with about 75 local leaders here to learn about their ideas for addressing chronic homelessness. And then I drew out common themes from those conversations into 6 overarching categories. You can see that the most commonly mentioned recommendations had to do with external systems, specific program models, and communications work. And then for the last part of the project, I analyzed 5 systematic reviews of common housing programs for unhoused individuals. And this chart provides an overview of the key findings. But notably, all 3 programs were associated with longer stays in housing. And when programs were evaluated for their impact on individual health outcomes and societal costs, the findings were generally mixed or insignificant. So to return to the guiding question, I looked at results from those 3 activities comprehensively. And if certain recommendations had come up multiple times, I determined that those were probably good opportunities that the city should look into further. So I made the following recommendations. First, invest in harm reduction models. This would include things like housing first, as well as low barrier shelters, needle exchanges, and trauma-informed case management. 2, facilitate external systems collaboration. This city is really well positioned to bring leaders from different sectors together and foster that kind of work. And third, leading public messaging. The city could be a great candidate for this role, just making sure that everyone from the general public to people who are unhoused understand the systems, how to utilize them, and also how to contribute. So in closing, these recommendations and my reports have all been shared with the Ward 3 office. And I'm incredibly appreciative of everyone who took the time to talk with me over the past year for this project. Many of them listed here, but it's not comprehensive. And thank you to the Training Center for the support to take this on. It would have been impossible without the stipend. So thank you for the time to learn about my project. And if you have additional questions or interested in references or some of the materials, please feel free to contact me over email. Thank you.